Breast is the most prominent feature in the thoracic cavity. So you can think seated upon two major muscles. We have the pectoralis major and the pectoralis minor muscle. But to men, it is rudimentary, but in female, it is very prominent. So because of this, in all that we know about women, we talk about them, sometimes we can crack joke and say, they just have a mammary gland. So at a certain time in life, when they begin to have breasts, and we call it the mammary gland, we say they are mamas. Okay, that's in child, maybe in cracking joke. But in actual sense, we say this is having an issue today. One of the issues that we are talking about is the breast cancer. When we talk about cancers, we are talking about this important element that bears the name of any particular place that it is. For instance, if it is at the breast, you can call it breast cancer or cancer of the breast. If it is at the uterus, you call it uterine cancer or cancer of the uterus. So it bears the name of every particular place that it is. So in this, because of this, we may have a certain time that there are lumps or masses within the breast. Some of them can be what we call malignant or benign. But then, before I talk about this, I want to share one important thing to you. We talk about breast self-examination. To the females, we tell you that on your own, you can do breast self-examination without any physician helping you to do the examination. How do you do this examination? We encourage you maybe to sit in front of a mirror in your house or maybe in your closet. Try to raise your hand above your head and then you make this to become more prominent. Once it is prominent in this order, it means that you can be able to touch it in quadrant by quadrant. For instance, if I want to show you, I show you with this paper. Prevention, this is my breast and I'm keeping my hand upon this way. You see at this particular place, you are seeing what we call the outer upper quadrant. Then you can as well see the inner upper quadrant. You can see here the inner lower quadrant. You can see here the outer lower quadrant. You see at the middle the areola and the nipple. Assuming you are asked to do this examination where your hand is at this point, you are asked to touch this place. We use the word pape. You can also touch this place. You can touch this place and touch here. Then touch down here. When this is done, you can say within yourself that you are feeling either a lump or a mass. When there is any, please do not hesitate to meet your doctor. When that happens, they may send you for a specific, maybe a scan. When they go for this scan, they can tell you, oh, this is a lump. They can mention the name fibroadenoma. They can also mention other things. Sometimes they can also have the one they cannot really identify and they test to go and do what is called mammography. When they come back, it is very, very imperative that the doctors send you to the surgeon that will do a surgery and remove this incision. We help them to remove this. When it is being removed, they send it to the histopathologist who will check on it. Within 2 to 3 weeks, they will bring out the result. They say, oh, it's a benign tumor. You say, praise God. If you say it's malignant, it may be at a point that can be well salvaged. Do you see the oncologists that are there? One of their work is to see this cancer that is within the breast, has it metastasized to any part of the body? They can also opt that you go for what is called mastectomy, removal of this breast. Removal of this breast can also be at that point. Then they can go for radiotherapy or chemotherapy. Some of these therapies are the things that are going to kill the cancer cells and keep this patient alive. We've seen so many who've lived for so many years, while there are some who begin to go to centers that are not seriously good, that will begin to use so many other things, infusing into their system, but there will be no help. So I encourage you, dear mothers, dear women, dear sisters, wherever you are, to take care of your breast. It is very important, as far as we are going to know that this is going to be the food to your babies tomorrow. For those whose theirs is getting atrophied, like our grandmothers, it's also important that they keep it alive. So continue to tell your grandmothers, your mothers, to do breast self-examination, or whenever they are also going to do that within the hospital, we know. Once there is any mass found in it, please do good by removing it. It's going to bless your life. Thank you.